All right, so I've washed my hands and my patient's about to come in. Hi, I'm Mackenzie. I'm a student physical therapist at Trine University. Is it okay if I work with you today?
Yeah.
What's your name? Go ahead and tell me about yourself a little bit.
My name's Griffin. The reason why I'm seeing you is I was dropped on my shoulder during a football practice.
Okay. Did it pop? What
did
kind of
pop.
happened?
It did pop. It hurt really bad. Then it went numb.
Okay. Do you have any tingling down your arm?
Not anymore. When it happened, it did.
Okay. What about pain? Do you have any pain with it?
Right now it's bearable, but it's dull and it's constant. It's always there. But when I do something with it, it's sharper.
Okay, so on a scale of 0 to 10, 0 being that you have no pain at all and 10 being you need to go to the emergency room, kind of where are you at all the time?
All the time it's about a 2.
Okay, what about when you move it?
It jumps up to a 5.
Okay, do you take anything for the pain?
Ibuprofen.
Okay. What about movements that increase the kind of pain?
I can't, from the side, I can't move it out anymore that way.
Okay.
When I have it, it's about as high as I can go, and it hurts extremely to get it any higher.
Okay. What about forwards? Do you have any pain in forwards?
About here.
Okay. All right, go ahead and relax for me. So what's going to happen is I'm going to kind of feel around in the shoulder. Okay, we're going to do some muscular testing. We're going to do a little bit of range of motion. I'm going to use this dual colligoniometer. It's just going to take some measurements to see how far of the range that you have from point A to point B. Don't worry about those measurements. They're more for my benefit than they are for yours. If you'd like to know them, I can tell you them. But other than that, we'll go ahead and get started, okay?
All right.
So I'm just going to kind of come over here. And I want you to go up as high as you can into that sideward motion. Is that all you got?
Yep.
Okay. Go ahead and relax for me. And you said there was nothing here?
No, that's about as far as it'll go.
Okay, so when I move it.
Right there.
You get pain?
Yeah.
Okay. And then I'm going to have you go ahead and put your arm to the ceiling for me. Is that all you got?
Yep.
Okay. Alrighty, so I'm just going to have you sit up straight. Okay. Does that cause any more pain?
Not really.
Okay, so we're going to take the measurements again, now with you sitting straight up. So go ahead and go out to the side again. Oh, looks a little bit better. Okay. Now we're going to come up. Little bit better. Still pain though?
Yes.
Okay. So now what I'm going to have you do is I'm going to have you come lay over here on the bed for me, this shoulder closest to me. Alright. So I want you to tell me when you start to feel pain, okay?
Mm-hmm. Right there.
Right there?
Mm-hmm.
Okay. And then we're going to come out.
Right there.
Okay. So I'm going to go ahead and I'm going to do these measurements again. Okay, laying down with me pushing a little bit. If it gets to be too much pain, you let me know. Okay. If you don't have a lot of room right there, sorry. Okay. Come out. You don't mind me laying that on you, do you?
Nope.
Perfect. Keep it right there. Good. Perfect. Now I'm going to kind of see if it feels any better this way.
That's about it.
About it? Okay. I'm going to go ahead and have you lay on your belly with your head down here and have it hang this arm off the edge of the bed. Okay. So now I want you kind of just to turn your arm out and then turn it back in. Good. How's that feel?
Feels good.
No pain?
Not really.
Okay. Go ahead and we'll sit back up a little bit. So I'm not going to do any more strength tests with you, just because you don't have full range. Okay, so we're going to keep working on that posture. Now if I push right back here, does that hurt a lot?
Yeah.
Okay.
It shoots up and
Into your neck? Okay. So we're gonna work on a couple exercises. One is gonna be to strengthen your overall shoulder. One's gonna help to decrease your pain, hopefully, when it gets angry at you. One's gonna be to help with those postural muscles so that maybe we can decrease the pain in your neck. And then one is going to be for your range of motion, okay? So the first one we're gonna do is they're called isometrics, okay? You're gonna find a door frame or the edge of anything. You're gonna keep your arm at 90 and you're gonna put it up against the edge. You can come over here and follow me here. You're just gonna push in and hold for 5 seconds. Okay, then you're gonna do the outside. Push and hold for 5 seconds. Forwards, push and hold for 5 seconds. Backwards, push and hold for 5 seconds. Okay, then you're gonna put all the way into your elbow. Push and hold for 5 seconds. And then all the way on your elbow on the outside as well.
All right.
Okay, go ahead and try some of those for me. See if we increase any pain. Increase in pain?
Going in, no, out, yes.
Okay. Is it bearable pain or is it?
Yeah.
Okay. About how bearable? What are we talking on the 0 to 10 scale?
3 and 4.
3 or 4? Okay. Good. We'll move on to the next one. Okay, so we're going to try to find a wall. And I want you to walk your hand up till you feel a stretch. Hold for 5 seconds and back down. Walk it up, hold for 5 seconds when you feel that stretch and back down. Try to go a little bit further every time. Now, when you're doing these, don't try to remember them all at the same time. Okay, so turn your arm over. There you go. I'm going to give you a home exercise sheet that you can take home that's going to tell you how many times you're going to do it and how often. Good. We'll move to the next one. So we'll come over here. We're going to do a wall scat push-up. So down, back up. Squeeze that pencil between your shoulder blades and back up. Squeeze the pencil between your shoulder blades and back up. Go ahead and try it. Squeeze. So we're going to focus here and then just relax back down. And then squeeze and back down. Good. Perfect. Good. All right. The last one we're going to do is we're going to find something to kind of lean over and grab a can of soup at home. Okay, and I just want you to kind of dangle your arm into tiny little circles, and that can of soup will help it pull out, and hopefully if there's anything pinched, it'll give you some kind of relief during the day, okay? I want to see you twice a week for the next 2 weeks, and at home you should be doing your exercises twice a day, 30 reps of each, hold for 5 seconds. Okay, if you need to do them more, that's fine too, if they're helping with pain or you think they're benefiting you more doing them more than twice a day, that's all right. So yeah, do you have any questions for me?
No, I think I got it.
Okay, well, it was nice to meet you.
Thank you.
Thank you. Okay, so for his 4 exercises, we did isometrics to increase his strength from 2 out of 5 to 3 out of 5, in specifically external rotation in the next 2 weeks. Wall scat push-ups are to improve his sitting posture to increase his total range of motion, and to decrease the neck pain that comes with the slouching. His wall climbs were to increase his active range of motion from 80 to 120 degrees in the next 2 weeks to improve his ADLs. And the weighted long axis distraction was to decrease his pain with movement from a 5 to a 3 and without movement from a 2 to hopefully 0, so that way we can take away those NSAIDs. So yeah, that's all I have.